Hello everyone, and welcome to today's Moxy Research Group webinar. The topic today is the effects on SmO2 after beet juice consumption in swimmers, and is presented by Sherilyn Misuuna from the University of Michigan. Sherilyn is a recent graduate and is looking to move on to med school in the future. Just a few notes on our protocol for today. Sherilyn will present for about 10 to 15 minutes, and then we're going to have a short break for a couple of questions. Then we'll do the second half of the presentation, then we'll have a longer Q&A at the end. We should have everything wrapped up in about 45 minutes or so. So if you have any questions, you can type them into the questions panel on the right side of the screen, and then we'll just queue up the questions for Sherilyn during our two Q&A periods. So with that, I'll hand it over to Sherilyn and she can jump into the presentation.
Hi, thank you to Roger and to Moxy for inviting me here tonight and for all the viewers who are watching tonight. It's a real honor to be asked to speak with you all tonight. As Roger said, my name is Sherilyn and I graduated from the University of Michigan earlier this year with an undergraduate degree in kinesiology. I majored in movement science. One of my classes this past spring was focused on wearable technologies. We learned about the science, particularly the physiology behind various pieces of equipment. In class, we talked about their validity, reliability, effectiveness, strengths, weaknesses of the pieces of equipment we studied. We also discussed how to incorporate them into the regimes of amateur and professional athletes. We were also challenged to think about further research potential of the use and validation of each piece. We were able to talk with the designers and ask them questions about the construction and the scientific background of their technologies. Later in the semester, we split into groups and were required to design and implement an experiment with one of the technologies. My group was particularly interested in Moxy and wanted to figure out whether this device could be added into the training without inhibiting motion and could also be used to accurately measure the physiological variables. This presentation is based off the final project my group completed. Today, I wanted to give a brief background as to why we were interested in Moxy and swimming and how we were going to accomplish this as a group. We decided we wanted to experiment with Moxy in the training of elite swimmers. To begin with, then, I wanted to give a bit of a background of swimming, racing, and training, and then explain why we're interested in exploring both the use of Moxy and beet juice in that context. While I was at Michigan, I had the privilege of being a member of the University of Michigan varsity swim team. This experience gave me a special perspective on the world of college athletics in general, and the swimming world in particular. I have found that most people in the U.S. know of competitive swimming, largely from the Olympics, mainly thanks to the great success of Michael Phelps and Ryan Lochte. In the Olympics, swimming events range from the 50-meter sprints to 10-kilometer open water races, but there are in fact races that are much longer than that. To date, the longest open water race completed in a single day was 88 kilometers long. That particular race was swum most recently in 2014, and the winner took over 9 hours and 20 minutes to complete it. As the distance and styles change in swimming, the training and physiological demands are also very different from swimmer to swimmer. The 50 and 100-meter events are considered sprints and are anaerobic races. The 200 and 400-meter long races are a mix of anaerobic and aerobic races, and the races longer are generally referred to as distance races and are primarily aerobic. Physically, you can see a large difference in the techniques of athletes competing in the 50-meter or 100-meter races versus the 400 meters and over, especially in their breathing patterns. For example, in the 50-meter race, a swimmer might breathe once or not at all, while in the 1,500-meter race, most swimmers breathe every other stroke. Additionally, when swimming this 50, swimmers will use what's called a 6-beat kick and kick 3 times per arm stroke. But when swimming the 1,500, some swimmers might only use a 2-beat kick, which is 1 kick per arm stroke. The 2-beat kick is designed to be more of a stabilizing kick rather than propulsion, and this is used in order to reduce the energy required by the large muscles of legs compared to the smaller muscles of the arms. Physiological differences would also be observed in different strokes. Breaststroke is much more of a kick-driven stroke as compared to freestyle or backstroke, which tempo is driven by the arms. Breaststroke also differs from that because the propulsion is from the legs. With different swimmers using different approaches, analyzing both maximal and submaximal efforts is directly applicable to performance. It might seem logical that sprinters should be concerned with maximal efforts since their events only last a matter of seconds. However, even sprint athletes can benefit from submaximal improvements. This is because swimmers, regardless of the distance, often train anywhere from 3 to 6 hours each day, improving VO2 max, increasing power, and perfecting technique. This amount of training cannot possibly all be done at maximal effort. As such, any legal substance advertised to increase efficiency and aid in performance is of immediate interest to every elite swimmer, regardless of their event specialty. The World Anti-Doping Agency has extremely stringent guidelines as to which substances may be consumed by athletes. So anything claiming to be an anything claiming to aid performance legally is worthy of much attention. As such, the recent research conducted on beets, particularly beet juice, has garnered much interest. Beets have been acclaimed as one of the world's most healthy foods. The effect of beets originally gained interest because of the clinical studies evaluating the benefits in many patient populations, such as cardiovascular, diabetes, and cancer patients. Beets are a natural source of many vitamins and nutrients, and they contain vitamins A, B, C, beta-carotene, beta-cyanine, biotin, folic acid, magnesium, potassium, phosphorus, iron, and fiber, just to name a few. Betaine has been found to be an anti-inflammatory, as well as functions in fat processing and lowering homocysteine by converting it to methionine. It has also been used to treat cardiovascular disease, but in preliminary studies, it has also been found to increase muscle strength, endurance, and power. Beets have been an interest to the sports physiology world because they also contain polyphenols, which aid in mitochondrial biogenesis and have been found to increase aerobic capacity. Finally, beets are very high in naturally occurring nitrates. Nitrates are naturally a vasodilator and clinically have been found to be cardioprotective. Dietary nitrate is absorbed in the small intestine, then travels through the external salivary cycle back to the mouth, where it is reduced to nitrate via symbiotic bacteria. Finally, it is reabsorbed in the GI tract and metabolized to nitric oxide through reductive enzymes. Beet juice is particularly interesting because of the pathway of conversion to nitric oxide. While nitrate from beet juice is converted by reduction enzymes, L-arginine sources require nitric oxide synthase, oxygen, and other cofactors. Once nitrate is ingested and converted into nitrite inside the body, it is circulated throughout the bloodstream. In low oxygen conditions, the body can convert the nitrate into nitric oxide and initiate vasodilation. Vasodilation then increases blood flow to the working muscles. However, beet juice has found to be beneficial in increasing performance in a mechanism other than vasodilation. There have been a couple of mechanisms proposed as to how this occurs. The first is that beet juice has been shown to affect mitochondria. Beet juice increases mitochondrial biogenetivity via a cyclic GMP-mediated mechanism. However, increasing biogenetivity is not an immediate response, and beet juice has been found to increase economy in a study only 3 days or less of implementation period. This is not the only mechanism at work. Additionally, Brown and Cooper, in their study conducted in 1994, described how nitric oxide has been found to inhibit mitochondrial respiration. In this mechanism, nitric oxide is a reversible inhibitor of cytochrome C oxidase. Another study suggested that the improvements of oxygen economy was due not to increased mitochondria, but to the muscle contractile properties. The graph on the left of the screen is from a study by Bailey et al. In 2010. The researchers in this study were trying to determine how beet juice consumption affected oxygen costs following a knee extension protocol. They recount that after 3 days of consuming beetroot juice during high-intensity exercises, individuals showed that a decrease in phosphocreatine and an increase in VO2, as well as decreased time to exhaustion and decreased estimated ATP turnover rate. The graph shows that the estimated ATP turnover rate during low-intensity exercise. The gray bars on the graph are the control, while the white bars show the effect of beet juice. They then concluded that the reduction in oxygen cost was due to the reduced cost of muscle force production. This conclusion was also consistent with a second study. The graph on the right depicts one of the results from a study by Larson et al. Their 3-day beet juice implementation found that during submaximal efforts, the amount of oxygen used per ATP produced decreased significantly after nitrate consumption. The authors concluded that the mitochondria became more efficient after beet juice. The other results found that the rate of ATP production increased after nitrate consumption. However, in their conclusion, the authors noted that these same results of less oxygen consumed during ATP production were not found in studies of acute high-intensity exercise. Regardless of the mechanism accepted, beet juice has found to improve performance. Larson et al. In 2007 conducted a study on well-trained male cyclists and found that nitrate supplementation caused reduction in VO2 and improvements in gross efficiency without any changes in blood lactate, heart rate, ventilation, or respiratory exchange ratio. Muggeridge et al. Verified these results in a similar study in 2014. Because there are no changes in these mentioned variables, but there were improvements in VO2 and gross efficiency, this suggests increased muscle efficiency, as it would allow for the greater work output with the same energy. This could also possibly translate into improved exercise performance. There were a very few number of studies that we found that looked at beet juice and its effect in swimmers. One of these studies, by Pina et al. In 2014, examined male master swimmers. The researchers used a tether to keep the swimmers stationary while they are attached to a metabolic cart. Results show that during low-intensity exercise and after the beet juice intervention, workload at anaerobic threshold increased as shown on the top graph. The bottom graph shows the decrease in anaerobic energy costs following beet juice. Additional results showed no improvement following the beet juice intervention during high-intensity exercise. To our knowledge, there have not been any experiments that...
Sherilyn, I'm going to jump in here with just one quick question, just for a clarification. Yeah. With these studies on the nitrate, or with the studies on the beet juice, is it the nitrate or one of the other components of the beet juice that is causing the effects?
Right. So that's what a couple of the studies were trying to determine. We know that the nitrate does have significant effects due to its vasodilation, but it could have additional effects beyond the vasodilation, which was looked at with the mitochondria and the muscle contractility.
Okay. Okay. All right. And just a reminder to everyone, if there are any additional questions, go ahead and type those into the questions box on the right, and we'll come back to those at the end. So I'll stop interrupting and let you get back to it.
Perfect. So, to our knowledge, there have not been any experiments that have used the Moxy monitor to measure real-time muscle oxygen levels during exercise in response to a vasodilator. The current studies have also focused on the male subjects and rarely used swimmers. Additionally, the swimmers that were tested were older males who only trained about 6.5 hours each week. We considered that nitrate supplementation may not have had the same effect on women compared to men due to factors such as changes in muscle mass percentages or hormonal differences in estrogen and testosterone. Further, swimmers use their upper bodies and limbs much more than runners and cyclists, and they are also performing in higher density water. Therefore, our experiment aimed to examine these variables and look to study the effects of vasodilators for real-time muscle oxygenation in female swimmers. We thought that the Moxy, a device designed to measure SmO2 percentage in a localized area, would be a good indicator on how beet juice changes oxygen availability and consumption across a maximal and submaximal level race. 4 highly trained level female swimmers were recruited to be a part of the project testing the effect of beet juice on SmO2 percentage. In order to mask the beet juice flavor, we mixed the juice in a smoothie consisting of half a banana and some cherry juice. The beet juice drink contained the beet juice in the concentration and quantity suggested on the package, which ended up being about 10 grams. The control drink was simply the cherry banana smoothie. The participants were told that they were testing the effect of 2 different types of drinks and were blind to which type of drink they received. Before using the monitor for our experiment, we experimented using it in the water. The Moxy was placed on the right quadriceps femoris muscle belly. In order to waterproof it, we placed it inside of 3 plastic bags and then used tough skin, which is an adhesive spray, and tape to adhere it to the skin. The first time, a small amount of water and air got into the plastic bags, which we believe caused the monitor to move around a little bit on the skin and to interfere with the signal and cause some missing data points. For subsequent trials, we made certain that there was absolutely no air in the bag and aligned them so that one opening corresponded with the end of the other. This setup seemed to work well. The entire experiment was designed in a 2-hour session on consecutive weeks. Each week, the participant performed a warm-up and a baseline measure consisting of 50 meters of maximal effort swim and a 200-meter submaximal effort swim. The participants were given beet juice or the control, waited 30 minutes, and then performed the 50 and 200-meter swims a second time. The 30-minute waiting period was the minimum amount of time we found in other studies that allowed for the beet juice to have an effect. Rest and recovery periods were also built into the 50 and 200-meter swims to try and reduce the effect of fatigue. We expected both the 50-meter and 200-meter trials to have a smaller decrease in muscle oxygenation due to the effects of the beetroot. Swimming performance is measured in time to complete the swim. So increases in performance corresponded to decreases in time. We didn't expect the 50-meter swim to have increases in performance because it is mostly an anaerobic swim. So increases in oxygenation would not have had as profound an impact because performances would be correlated to utilization of the creatine phosphate system as well as to anaerobic glycolysis rather than aerobic respiration. We did, however, expect an increase in performance in the 200-meter swim. Because Moxy measured the SmO2 percentage, we hypothesized that the beet juice had been shown to increase both blood flow to the muscles via vasodilation, as well as decrease oxygen cost of exercise by whatever the mechanism, in both maximal and submaximal efforts, that the swimmer's time would decrease and there would be less of a change in the SmO2 after consuming the beet juice. This is a graphical representation of the raw data for one of the subjects over the course of 1 day. The blue line represents real-time muscle oxygen levels, and the next few slides I'll explain what sections of this graph were important to the study. So the gray area that's shaded on the graph right now is what I'm going to be talking about. So to begin with, each participant began the session with a self-guided warm-up in which the SmO2 hovered slightly lower than the resting values. Immediately after warm-up, the first 50-meter maximal effort swim was completed. As each day doubled as its own control, the second testing period was conducted about 45 minutes after the first. This was about 30 minutes after the subject took either the placebo or the beetroot supplement. After the 50-meter swim, each participant was given about 5 minutes to recover, in which all participants swam about 200 meters at a moderate intensity. After the recovery periods, the participants were instructed to perform a 200-meter swim at an 85% effort. In these trials, the SmO2 decreased significantly from the resting periods, but it did not drop to a level as low as the maximal effort swim did. It is important to note that the swimmers are at an elite level and were expected to know by daily practice what the 85% effort would feel like. So it was assumed that this would be an independent variable. In between the two trials, the subject was given either the beetroot or the placebo drink, and then they rested for 30 minutes in order to allow for the beetroot supplement enough time to digest if the subject had received it that day. One of the first things we analyzed when we uploaded the data was how similar each of the trials was to each other and the validity of the data between the participants. This graph shows that the data from all 4 participants overlaid on the same graph. The highlighted regions again show the maximal and submaximal efforts. Although each participant started at a different absolute SmO2 percentage, there were clear drops in SmO2 at about the same time and place. We were excited as this clearly illustrated how this affected the percentage and that the Moxy was a helpful device to use in swimmers. The experiment was repeated and the data from one participant was recorded over a second day, 1 week later, and this resulted in 4 repetitions of each testing block. These trials were overlaid to show the consistency in timing and amplitude of the drops of SmO2 across the trials within the same participant. This graph was also exciting as it showed how consistent the results were within the same participant, especially when considering the relatively large drops between the submaximal and maximal level swims. Additionally, the 50-meter maximal effort swim showed a greater drop in the SmO2 than the 200 submaximal effort did. Due to the differences in oxygen demands in the submaximal and maximal effort swims, the results were exactly what would have been expected. This provided some evidence that the Moxy device was effective in collecting the data in the swimmers. In order to quantify that there was a change in SmO2 following beet juice, we wanted to qualify what the change in SmO2 was. We were not primarily interested in the absolute drop in SmO2, as by looking at the previous graphs, it was clear that this occurred with or without beet juice. But we wanted to know what the percentage the SmO2 changed from a 10-second average immediately before the repeated to the minimum SmO2 value during the repeat. We calculated and compared these values from the repeats before and after the beet juice consumption and plotted the differences on the graph. We found no constant change in SmO2 with the addition of beet juice compared to the control. Times and heart rate values were also relatively constant before and after beet juice, with no clear trend indicating an increase in performance due to beet juice consumption. Though these results did not confirm the hypothesis, it is likely that this was due to a small sample size, little repetition, and poor control conditions. A repetition of this project should include more subjects, have maximal and submaximal efforts further separated, or even on different days, as well as having a longer trial than 200 meters for the submaximal effort. It would also be preferable to have multiple trials of the same repeat. Personally, I was really fascinated by this project. I would love to see research in determining if the lack of results was in fact due to the small sample size and lack of repeatability, or if the beet juice really did have a different effect because the subjects were both female and highly trained athletes. This could be determined by including similar training males and females in the same study. Overall, though Moxy did prove to be effective in swimmers and could easily be adapted by coaches to enhance training in athletes, it could also be used to determine differences in oxygenation across different strokes, as well as determine stroke efficiency by placing two monitors on contralateral arms or legs, or to determine if a different technique is more effective. Beet juice has shown much potential for further studies in both amateur and elite level swimmers. And then these are all cited.
All right.
Thank you.
Thank you very much, Sherilyn. That was an excellent presentation. We have a couple of questions here coming in, and if anybody has more questions, we should have time for them, so go ahead and type them in. So the first one here, did you do any work on any other muscles?
No, we didn't. We stuck with just the right quadricep.
Okay. And then how did you download the data?
We tried at first to do the real-time data, but because the monitor was in the water, I guess there was interference, so we couldn't get the Wi-Fi. So afterwards, we ended up just plugging it into the computer and downloaded it that way.
Okay. And the next question is actually for me. It says, Roger, would putting the bags over the sensor appreciably affect the readout due to interference with the light transmission? And the answer is no. We use the Moxy inside a plastic bag quite a bit. It's the sensors are waterproof, but you know, it's just, it keeps them nicer and neater, and if you're going to be underwater, you know, it gives you that extra layer of protection. So a clear plastic bag typically doesn't cause any problems with light transmission. So I'll take that one.
Yeah, as I say, we did 3 and it worked. We had really clear data.
Okay. And then the next one, it says, was the product a pure beet juice product or a commercial product?
No, it was pure beet juice.
It was pure beet. Was it an extract, or was it like a powder?
It was a powder. We mixed it into the smoothie.
Okay. Okay, and then we've got another question here. Is there a study of the benefits of loading with beet juice or taking beet juice in endurance racing and the effects on SmO2?
Yes, there are. I had a couple in my work cited, but I can pull them out and highlight them.
Okay.
I can't tell you exactly which ones they were off the top of my head, but yes.
Okay, okay. Another one here, great project, Sherilyn. Did you do rolling averages of the data, or was any other data massaging done?
By rolling averages, oh, sorry, no, we didn't. The only averages we took for the data was the 10 seconds before and after the minimum in order to see the differences, but the rest of it was just the raw data, and we picked out the maximum minimum points.
Okay.
Did that answer?
Yep, I think that's what they were getting at. Is it the beet juice being absorbed into the blood impacting, let's see, I gotta read this right. Is it the beet juice being absorbed into the blood, the impacting nature, or is it the nitric acid that comes from the mouth, and does that travel back down to the GI system?
So in order to be absorbed by the blood system, it has to go through the mouth and then to the GI tract, and then it can be absorbed into the bloodstream. So that's the mechanism the dietary nitrate worked. Okay.
Okay. Okay. This one's a comment. Yeah, and this is I like this comment. The large drop in SmO2 shows the short maximal efforts, the 50 meters, are largely aerobic, not just anaerobic, as you hypothesized. That's something we talk about quite a bit. That large drop in oxygenation means you're using a lot of oxygen during, in order to cause the drop. So that's a comment from one of our viewers there. Any other questions? I got to the end of the list. If anybody has any other questions to to submit here. Okay, well, thank you very much, Sherilyn, for presenting this. We really appreciate it. It's great data. We're getting a lot of positive comments here. I will post this webinar recording up on the on our forum, and if anybody has any additional questions, I'll make sure that I ask Sherilyn if she can answer them on the forum. So thank you again, and thanks everyone for attending. We really appreciate it. And just for a little bit of a commercial, we've got another research group webinar coming in next week. So check our website under the training tab for that. So thanks everyone, and have a great night.